Good evening. This is the Winnebago Tribe of Nebraska's weekly COVID-19 update. And this week, I wanted to start off by reaching out to all those who have been affected by COVID-19. If you're a survivor, if you had a family member, if however you've been affected, that I wanted to reach out to you and encourage you and understand that we're all in this together, and that I'm really proud and really encouraged on how we are, how we have come together as a tribe and all of our entities in the tribal organization. So with that, I wanted to pass it along to the CEO of the Winnebago Comprehensive Healthcare System, Danelle Smith. Thank you.
Thank you, John. Good evening, Winnebago. Thank you for joining this week's live stream update for the COVID-19 update. We really appreciate everybody's input who responded to the survey that we put out to try to improve the format and content for our live stream update. And one of the changes that we've made this week is to pre-record this session and air it in the evening time for the community, since we know a lot of people are working during the afternoon hours. And so we hope that this new time frame for you will work well. We're continuing to review all of the suggestions that came in, and we'll make modifications as we go forward. And with that, I'd like to just go ahead and jump right into this week's presentation. And I'll go ahead and turn it over to Mona Zufante for any comments that she wants to make and to move into our updates on COVID-19. Thank you.
All right, thank you, Danelle and John. I'll just go ahead and start with community updates, and good evening, everyone. So for the current status, in Nebraska, we've had 328,673 total tests. Of those, 297,553 were negative. There have been 30,825 that have been positive, 368 deaths. Within Winnebago, we've tested 647 people, 547 were negatives, 100 positive with 90 recovered, and we have 3 deaths and no pending tests. Of our non-Winnebagos, but tribal members, there have been 540 tested, 452 negatives, 87 positives, and 1 pending test. So some of the updates that we have on the next slide, there we go, COVID updates. So if you were previously positive it has been over 90 days and you have a new exposure, depending on your release date, we may be putting you back into quarantine. And that is looking at the CDC guidelines, which are ever changing. But as of today, we will be looking at those and following those. So just because you've been positive doesn't mean that you escape quarantine now. So we'll be looking at those. We have some program updates. We're going to have 2 surveys out. One is for gathering input from our high school juniors and seniors on an internship program we're developing. We're also going to be having another survey out gathering input on redesigning our health promotions and outreach program. So we would like to gather input from our community on what you'd like to see in that program. And then some other updates. Starting September 8th, we're looking at starting the shuttle services again. We will be having a new pickup location. It will be at the Urban Indian Center on Geneva Street, which is right off of Hamilton. So look for the posters. We'll also be working on extending Whirling Thunder Wellness Center's workout rooms. We will be extending until 7:30 each night, and that doesn't start till the 8th. And then we will be opening up Land to Wellness fields for everyone to be using. And now I'll turn it back over to Danelle for the hospital updates.
I just have a few things to go over for the hospital. We talked about some of this last week, and just as a reminder to everybody, We did modify our policy with regard to selling food products in the hospital. Individuals who come into the hospital with the intent of selling food will not be allowed on the premises. This rule has been implemented so that we can ensure compliance with our infection control regulations, and it also helps to just ensure patient and staff safety and eliminate the potential for further spread. As everybody knows, we are just trying to limit the number of people that are in the facility, and so we will not be allowing food vendors to be in the building. All patients and visitors should use the east entrance by the emergency room to come into the building. The front entrance is reserved for the pharmacy drive-up and for employees. So again, all patients and visitors are asked to use the east entrance. In order to further promote physical distancing and social distancing, we have certain waiting areas that are designated based on what the purpose of your visit is in the facility at the hospital. So these areas are going to be marked, and the greeter who is stationed at the door when you enter can help guide you to which waiting area you should be using. As far as monitoring for potential symptoms for COVID-19, all of our staff are continuing to self-evaluate, and our staff are instructed to report any symptoms prior to reporting to work. And so that is something that we're really trying to do a good job of educating our employees about. They know what monitoring and what symptoms and what things they should be keeping track of. And we have an employee health nurse who is assisting with anything in that regard. Lastly, the PPE is mandatory for staff, and so this includes masks and eye protection. So when you come into the facility for an appointment, you'll see that our staff are wearing masks and eye protection, and masks continue to be required for all patients and visitors in the facility. This next slide is just another overview, some of the same information that I just went over and a few additional items. So just practices for entering 12 Plans Unity Hospital and the Winnebago Comprehensive Healthcare System. Again, all patients and visitors are asked to enter through the east entrance down by the emergency room. Masks continue to be required. Physical distancing is very important to help us control the spread of COVID-19. And so to the extent that you can, you should always try to maintain 6 feet distance from others in the waiting areas and throughout the hallways at all times. We will continue to have a greeter at the entrance of the facility. And so the greeter will be continuing to ask questions as you enter. And we have our visitor policy where each patient is allowed to have one other person accompany them inside our facility. And the person who is accompanying you, if you do need to bring somebody with you, must be 19 years of age or older and have no signs or symptoms of illness. For temperature screening, we will continue to have that available through thermal temperature kiosks and sanitation stations that are available in the entryways to the building. And so just to continue to update you about what to expect when you come to 12 Plans Unity Hospital for an appointment or to the facility. That concludes our presentation. Thank you.
All right. Thank you, Danelle, for that update. At this time, we're going to go into the updates on behalf of the Winnebago tribe. We have an update from the Security Task Force, the Pandemic Task Force, to the Winnebago people. And the update is, on August 3rd, 2020, Winnebago Tribe has hired 15 tribal security officer positions for the tribal programs within the community. The security positions are temporary funded positions until December 2020. The security officers are currently assigned to several tribal programs, and they are being used for COVID-19 prevention by screening people entering a building. The security guards are from within the community, and they are excited to help. The security guards have face masks that identify them as tribal security, and they have other uniform attire ordered, such as a polo shirt and traffic vest to help identify them. So we appreciate your folks' cooperation as you enter some of the buildings throughout the Winnebago tribe. And please give them your undivided attention and abide by the protocols that they have set up to keep our community and our employees safe during this pandemic. So at this time, we'd like to introduce one of our newest team members to the Winnebago tribe of Nebraska, new COVID-19 grant coordinator, Billy Kitchian. Billy, do you mind saying a few words to the viewers out there?
So, good afternoon, everybody. It's nice to meet everybody. It's great to be here. My name is Billy Kitchian, and I am the COVID-19 grant coordinator. One of my main responsibilities is just to be aware, on top, monitor all of the COVID-19 activities. The tribe has received a few different funding sources for these, and so with those, we just have reporting and monitoring to do for all the projects. So if anybody has questions about the projects or anything, I'm working with all of the sub-award or subcommittees on their projects, and am available for any questions. I am located down here at the planning office of the tribe, and I can be reached by email, billy.kitchian@winnebagotribe.com.
All right, thank you, and welcome to the position, and we appreciate all the help that you're doing with us, Billy. And definitely there's a lot of different projects and a lot of different parts moving here in response to this pandemic. So we appreciate everything that you do.
Good afternoon, everyone. Just some updates from the school perspective. The administration, they've been meeting with parents and guardians of students choosing the homebound remote learning educational setting. During this meeting, they are reviewing the contract that was put out, and the parents are getting signatures from the parents. Again, I want everybody to understand that the end of the first semester is January 28th of 2021 due to the late start and the 4-day week. At this time, we have about 164 students staying on the homebound setting and 368 coming to school in person as of today. So we'll be setting meetings up that I believe it's the 1st, 2nd, 3rd September for the in-person in small groups, so that they can come in and get see what's going to happen in the building for their parents and the kids. All fall sports other than varsity football are still going on as planned. High school cross country and volleyball started practice on Monday. Junior high cross country, football, and volleyball will start on Monday the 31st. A code of conduct can be picked up at the front desk. Again, remember, physicals are required for all incoming kindergarten students, incoming 7th grade students, any new student coming in from out of state, and any freshmen wishing to participate in athletics. Incoming 8th graders, sophomores, juniors, seniors who participated last year are exempt from needing a physical this year. Any student who did not participate last year and wishes to participate must have a physical. On Monday, Tuesday, today, and tomorrow, we've had teachers out at the corn harvest helping out. We've had 20 to 25 teachers a day out there working with HCI Farms personnel, and it's been going really good. A lot of positive comments on teachers being able to learn something about the tradition, the culture, and also just being able to mingle with their peers during that time. Sarah Snake has been out there through most of it. I know she wasn't there today, but guiding us along that path. So I believe we did probably 30 screens. The volleyball girls actually did it on Wednesday to earn some money for their volleyball program. So it's been a real good experience for the staff, and we'll see what happens from there. Other things that are going on is we donated some corn to HCC. We took it out to HCCDC today, and I think we had 90 bags left from last year's Academy corn, and they'll be putting them in some of the boxes, 90 I think of the boxes tomorrow for the handout. So we're doing some things here, and I think we've learned some things through this, as far as how we will proceed in the future on this. Then we had a conversation today with on the internet services and with George, our Michael from down in Macy and ICC, and we might have a possibility of using their towers at Wall Hill to at least hit some of our kids on this half, at least up to the and they're going to check in and see if we can come all the way to Winnebago to help reach some of our kids until we get our towers and everything in place, which hopefully will be soon. So we're continuing to work on it. Again, we'll be handing out the stuff to the parents on the week of August 31st for the homebound kids with directions on how to use the Chromebooks and all the information to get into the Google Classrooms. Again, thank you, and we'll keep you updated on the transportation issues that keep popping up. So that will be interesting, and we'll just work through it. Been working with Jamie quite a bit on that issue as we continue that road project through the community. Thank you.
Thank you, Dan Farringer. Dan, we do have some questions in the question and answers portion, so we'll invite you when that session comes up to help us get those questions answered. At this time, we're going to move on over to Little Priest Tribal College. President Patel. President, the floor is yours.
Good evening, the community of Winnebago, Nebraska. I hope everybody's well and staying safe. Little Priest Tribal College will be starting its a fall semester on Monday, the August 24th. We are excited to welcome the students, the parents, the family members, and the community. But here is some very key information I want to make sure that the students and the parents, the community are aware of. This is extremely important as this is time sensitive. For new students coming to Little Priest Tribal College, the last day to register is tomorrow. And I would like to emphasize the importance of it because next week, it's only for the returning students that do till next Wednesday, the August 26th. So I want to repeat this. New student registration is tomorrow, August 21st. Returning students can register for classes till August 26th. So please do not miss this opportunity. Please share this information with your family and friends. And many students, which usually are, many of the students are Title IV eligible. I've repeated this many times and I'm going to still keep repeating this. You get 2 free classes, free textbooks, free laptop or a Chromebook. If you're a part-time student and if you're Title IV eligible, you get 1 free class, 1 free laptop, and 1 free textbook. This is due to the federal tuition grants available from the CARES Act. So, on behalf of the college and the Board of Trustees, I'm requesting the community to spread this news so that the students do not waste this opportunity. I've been telling this is, the Christmas came a little early. So, don't look under the tree, just come to the campus here. Come to the campus, there will be a screening. I'll give some phone numbers. The FAFSA, if you want to complete the FAFSA, which is a requirement for the free textbook and stuff like that, it's 402-878-2380 and click on option number 1. For admissions, 402-878-2380, option 2. Visit littlepriest.edu on the college website. We are updating the website on a constant basis. And we are also updating the Facebook, Little Priest Tribal College Facebook. It is extremely important for the community not to waste this opportunity. Learning cannot stop. And also, we have student orientation today. Actually, it's going on. The first session is going on right now. And there is a session orientation tomorrow. All students must attend at least one of the 2 sessions, especially this time as it's completely online. So we are here to help you. The college is committed to serve our population. If you need anything from the college, we are just a phone call away or an email away. So requesting anybody interested to take classes to reach out to us. Learning cannot stop. Have a great night. Thank you.
Thank you, President. At this time, we have Mayan Beltran from Winnebago Casino and Resorts. Mayan?
Good evening, community. Just like to say hi from Winnebago Casino Resort. Our second phase has been open for a month now, and week to week, our business is growing. We're getting back to some kind of normal out here. Not a lot of updates from the last meeting, except for, please be safe out there when you're coming to the casino. Wear your mask, practice social distancing, and protect your elders, protect your children, your families, and your friends. Thank you. That's all we have to report from Winnebago Casino Resort.
Thank you, Mayan. At this time, we'll turn our attention to Sam Burrish, Ho-Chunk Incorporated. Sam.
Thank you, Garen, and good evening, everyone. I have a brief update today. The Ho-Chunk Farms Indian corn harvest is continuing, and helpers are appreciated. We'd like to thank all of the community members, school groups, and Ho-Chunk employees who've helped so far. If you'd like to help, this is happening at the Village Market behind the Dollar General. Community members who help do get to keep a portion of the corn they process. Please wear a mask and respect distancing. Speaking of the market, the Wednesday Farmers Market at that location continues through October. It's each Wednesday starting at 1 p.m. You can learn more on Facebook by finding the page for Ho-Chunk Village Farmers Market. And lastly, a deadline is approaching for agriculture business grants through Ho-Chunk Community Capital. It's a $500 grant for Native Americans involved in agribusiness or other food ventures who also participate in the remainder of the farmers market season. The deadline for that is August 31st. For more information, contact Tony Wood at Ho-Chunk Community Capital or visit their Facebook page. Those are the updates I have for today. I'll turn it over now to Brian Mathers with HCCDC.
Thanks, Sam. So good evening, everyone, first of all. Tomorrow, which will be Friday, August 21st, we're having another of the Farm to Food Distribution mornings. That'll be our second to the last one. The program is ending at the end of August. We just got confirmation of this yesterday. They weren't sure how long it was going to go, or now it's only confirmed through the end of August. So we'll plan to do the distribution tomorrow and a week from tomorrow, Friday the 28th, and that'll be the end of that program so far as we know. There's some possibility that USDA might extend it through some additional legislation, and that they would have to pick a new vendor, and then we would have to figure out who the vendors were going to be and get the distribution set up with them. But we'll watch for that. And if there's more opportunity to extend it beyond the end of August, we'll certainly do that. It's been a great program over the summer. We started this in May, mid-May, and since then we've done 240 of those produce boxes a week, which totals up to about 3,360 food boxes, or 84,000 pounds of fresh food, fresh fruits and vegetables, in addition to the supplemental products that were purchased with foundation donations to the community and made available to folks. So it's been a lot of good stuff that's been we've been able to distribute to people. I want to thank our own staff that's been working on that: Quince Bass, Michelle Parker, Lisa Max, as well as the USDA providing the food boxes, and CNC distributors for putting us on their route. And then our other local partners, HCI, who provided ambassadors and interns to help with the work involved in getting all those perishable boxes of produce up so quickly every Friday morning. and the Winnebago Community Health Systems for helping get a portion of those boxes every week to high-need people that are in isolation or quarantine, or elderly people that wouldn't have access to the food otherwise. And then also Sweetgrass Trading Company, which helped us source some of the supplemental products that were handed out with the boxes. Tomorrow's, as Mr. Ferringer mentioned, we have about 90 quarts of the dried corn to distribute to the first 90 households that get there. So we encourage people to come right at 8 o'clock. We'll be ready to go with that stuff, and we'll get it moved out as quickly as possible. And as I said, that'll be the next to the last day. A week from tomorrow will be the last day of this, so far as we know, where we'll also just have the 240 boxes to give out. So that's my update. Thanks, everyone. Stay safe.
Thank you, Brian. Appreciate it. Great update. At this time, we're going to go into the question and answer session, and we do have some questions here for Tribal Council as well as the healthcare, and so we'll get into the question and answer. As always, if you do have a question, make sure you email COVID@Winnebago Tribe, and we'll get it onto the next live stream. So the first question here is for the health officials. What does 12 Clans know about the new saliva rapid tests, and when will we start getting them?
I can take that question, Garen. So we did receive information that the FDA issued an emergency use authorization for a saliva test. It's actually not a test kit in the same way that the other tests are. It's a protocol that can be used by high complexity labs to do testing for COVID. And it's available only on a very limited basis right now. And you have to be an authorized lab in order to run that test. And right now it's only being utilized at the Yale School of Public Health. And so we are paying close attention to that and any new developments that come forward. And certainly if it's possible for us to access different kinds of testing and rapid testing at 12 Clans Unity Hospital, we will take that opportunity. So right now that saliva testing, like I said, is a protocol that's available for certain labs that are authorized to use it. So it's very limited at this point. But the intent, of course, is to make those kinds of tests available on a much broader basis.
Thank you, Danelle. And just kind of a follow-up question. Is it as invasive as the current tests now, or is it just a swab of the saliva?
Yeah, it actually is. It's different because it's not, going up through your nose. But as I understand it, that type of test is still, fairly uncomfortable. None of that is fun, but we'll keep an eye on it.
Definitely. The next question is, I'm going to direct this one to Dan Ferringer, the superintendent of the Winnebago Public Schools. Will the kids be required to watch a return to school video before going into the school? And also, are all teachers required to wear a mask the whole day?
Yes, we've been visiting, and the first couple of days of school will be going over protocol. We'll show the video of safety. We're going to do that with the staff also. And will the teachers be required to wear masks? Yes. And then this was just delivered as we were sitting here on the thing. All the students will have this around their desk, and they're easy, they're light, and they can fold them and take them to their next position. So we'll also have that in front of every student that's in person at the desk, and they can take to the reading table. We're looking at 9th through 12th grade. We'll be eating in the cafeteria, so we're even looking at having those down in the cafeteria in certain areas. Along with the mask, they're going to be pretty safe, and the teachers will have one on their desk also. So we're doing everything we can and getting as much. We have all varieties of face shields up here, from mask to masks that you can see your lips moving in, to neck shields, to the pull-down shields. So we have a lot of, along with sanitation throughout the whole building. And we also just got in a new thermal reader. It comes in and it tells you, takes your picture, so it's all documented, and you put your wrist in front of it, and it tells you normal temp, please wear a mask. It tells you all that as we move on. So we have a lot of precautions going on, and we'll be getting more if we need them.
Thank you, Dan. Next question. This one I'm going to direct towards Mona. When is it recommended to get a flu shot? Heard this season is going to be really bad. Is the health department even open to give flu shots? Mona.
It's recommended to get a flu shot anytime from like October till almost April. We tend to get our flu vaccine in around October, sometimes November, depending on when we receive it. We will be setting up our flu shot clinics just like we have in the past. We've never closed, so we've been open. We've actually started our catch-up clinics for immunizations for our children this month. And we will just continue to make sure we have our preventative measures in place as we do for all people.
Thank you, Mona. Next question for the health officials here. It says you guys should do a doctor spotlight or a nurse spotlight on these live streams so that we get to know the staff. Can any of the health officials address that question?
I actually think that's a really good idea. So I appreciate the question and the suggestion, and that is certainly something that we can work on. We have, a number of doctors and nurses and other providers throughout the facility that do a really good job. And so I think if we can use this as an opportunity to introduce them and allow the community to get to know them a little bit better, then that would be a good thing. So we'll work on that.
Thank you, Danelle. The next one is I'm going to direct to Vice Chairman John Snowball. This one here, it says, is the Winnebago tribe going to alter their election schedule due to COVID-19? Also, a second part of that question is there going to be drive-up voting available?
That's a good question, and I think we had a good test run as we just recently had a special election, and to my knowledge, it was handled very well, and there was no known transmissions from the election. So I think we had good practice, and this will actually be our second election that we're conducting during this pandemic. So I'm really confident moving forward and that all the right precautions are in place and get the right people working at that. Thank you.
Thank you, John. Next question for the health officials. Why is Winnebago getting more cases lately? Do we not do contact tracing? We should be able to at least know that information because they can't tell us who has it. At least tell us the source. The national news tell us where the hotspots are. Please list the Winnebago hotspots.
So I don't know if we've been getting more cases. We've been averaging about 1 to 2 a week. We did have that influx about last month. And since then, we've had about an average of 1 to 2 a week. This will probably continue until we get our vaccine available nationwide. But we do contact tracing as soon as we get a positive. It really depends on when their symptoms have started. And then we go back 3 days from that day. So everybody varies. Everybody's different. Some people think it's just their allergy, so they don't come in for quite a while. So like I said, everybody's different. It is community-based. So that means that it's just out there. Winnebago is not very big, so I'm not going to tell you it's on Wilson Street or something because that's not appropriate, or anywhere else. So we could just say Winnebago could be a hot spot, but to me a hot spot would be more than 20 cases. And so with 1 or 2, I don't think so. There's also been roughly 60 households that have been affected by COVID when I ran through some of the numbers. So that's households. And so when we look at the overall Winnebago community, we have, over 500 households. And so many of the households, once they have a positive, because they've been doing what families do, eating together, talking together, hugging and communicating, that we'll see another positive within that household. And that's what we've been seeing.
Thank you, Mona, for that question, or for that answer. The final question that we have today, and if the health officials, Vice Chairman and Billy want to chime in on this one, the question is, when is Winnebago giving away money like all other tribes are doing? We'll start with John.
I can answer that, Karen. So the CARES Act is there's guidance there, and we've had our best people work on it, and we've developed ways to distribute and to utilize these funds that we're confident in, that we're really confident in, and that are going to go a long way, and that they're reaching the people that are affected. So understanding that this whole thing is going to get audited, and that we really want to utilize these funds in a smart way, and that all tribes are different. You know, we have a really focused community here, and some tribes don't have that. Some tribes their members, the reservations ain't like ours. So I would say that all tribes are different, and that was all things were discussed, and with our best people, with calling in as many resources as we can, and we've developed these plans. And so I would say that much, that tribes are different, and we're really confident in all the ways that we've developed to disperse these funds in the many different ways. So thank you.
Thank you, John. And anybody else want to tackle that question?
I could just add on that, in all of the webinars or regulation things that I've read, it's very clear that that a per cap or a blanket payment isn't recommended to be used from this funding. Other tribes that have done that, I feel that they're going to, in the end, have to pay that back if audited and the detailed documentation is not there to support those payments. And so I think that the Winnebago tribe has done great innovative work to figure out how to provide support to our community in the immediate and for future purposes. We're going to see positive impacts from this, and we're hoping that there'll be another utility assistance payment available for tribal members in the fall to assist with some of the increased winter costs. So these are the types of things that we're doing for the membership rather than these blanket payments. So I'm hoping that the community can all take advantage of those, but understand that all of these federal monies are tied to federal regulations that we must follow.
Thank you for that answer, Billy. And I know that it's been on the minds of a lot of people. And so we appreciate John and Billy for that good answer on that. With that, ladies and gentlemen, that is today's weekly COVID-19 update. And as always, if you guys have any concerns or any questions for the health officials, the Tribal Council, Little Priest Tribal College, Winnebago Public School, Winnevegas, HCI, and HCCDC, make sure you email COVID@Winnebago Tribe. With that, you folks stay safe out there, and school is going to be starting here, and we appreciate everybody that is using those precautions. Keep wearing the mask, using hand sanitizers, and social distance. You folks have a good evening, and thank you for watching today's live stream update. Have a good day.
Thank you.
Thanks, everybody.
Thank you.